Landon is Executive Medical Director of Infection Prevention and Control at the University of Chicago. She joins me now from the city there. Hi, Doctor. It's a good seeing you. So there is record that we know of a man in Hong Kong who'd been infected with the virus a second time. But is it possible President Trump could be immune for possibly a lifetime, as he says?
Well, we don't know enough about COVID yet to understand exactly how long immunity lasts, but there have been more than a few cases of confirmed reinfections. Because diagnosing that reinfection requires sequencing of the original virus and the second virus, it's actually very difficult to make that diagnosis. And there have been many more cases that are assumed to be reinfection. So we know that people are not immune for life most often. I think it is a little bit optimistic to say that one is immune for life after a single infection.
Well, it's now been about 11 days since his symptoms first appeared, and with medication, they all seem to have improved, according to his Dr. Sean Conley, who also says, by the way, that there's no longer evidence of actively replicating virus. Can you tell us at what stage of the disease is a patient no longer contagious?
So for people who have mild to moderate disease, we are confident, and all of the public health guidance is around at least 10 days of isolation and then being afebrile with symptoms improving for at least a day. Now, when people have very serious disease and need hospitalization or steroid treatment, anything like what we saw in the president, then we expect that people need to isolate for 20 days. Now, the president could be no longer infectious. There is good evidence that even seriously ill people do not have a lot of contagious virus. We don't identify a lot of contagious virus after 10 days. And so he may be okay now. However, I think it would be presumptuous to say that he is definitely fine, and it's certainly safer to go with the more stringent rules about public health. And he can do a lot of campaigning, even without having to be with other people.
Well, the president was on a cocktail of, I believe, 3 different types of medication, some of which is only given to people in extreme cases of COVID-19. Since he seems to have recovered, is this now permission for people who are sick to take the medication that he's taken?
So we never give an approval for a medication in the United States based on one patient's experience, and it wouldn't be appropriate to do so now either. The president is the only person who's received all 3 of those drugs, the antibody cocktail, the remdesivir, and also the steroid. Of course, remdesivir and steroids are routinely given to many patients. It's those monoclonal or polyclonal antibody cocktails that were used in compassionate use and have not been used in combination with the other drug. Now, I think those are very, very promising. And we saw some of that with the president, but they still need to go through all the steps necessary to make sure that they are safe and effective in a larger population.
Just quickly, your thoughts, Doctor, on his gathering at the South Lawn on Saturday at the White House. Your thoughts of all these people so close together, I believe hundreds of them, while the president stood on a balcony giving his speech.
Well, he certainly had a sufficient amount of distance to protect those individuals. Nonetheless, I still think that not following public health recommendations is setting a very bad example for our country. It is suggesting to people that they don't need to follow the rules, that they can just do whatever they think is good for them in the minute, and that is not going to protect people.
All right, Dr. Emily Landon, thank you for sharing your thoughts on this. We appreciate it.